You're listening to episode number 20 of the Nightingale podcast. In this week's episode, we get to hear from Sharlene Cordes BSN RN. She has such an interesting journey to share. She is a NICU nurse, a flight RN, a travel nurse, literally all of the things. And she has such a great nursing journey to share with us today. This week's episode is brought to you by my free guide to starting a new position. So make sure you go check it out at www.thenightingalepodcast.com. And don't forget, this guide is for everyone, a new nurse, a nurse who has lots of experience. This guide is literally for everyone, and make sure you share it with a friend. Also, if you are loving the Nightingale podcast or you are loving this episode, make sure you tag the Nightingale podcast and share it on whatever social media platform that you like so we can get the Nightingale podcast into as many hands as possible so that you can hear these amazing nursing journeys. Hey friends, welcome to the Nightingale podcast. A podcast for nurses, future nurses, and, well, anyone interested in the nursing profession. I'm your host, Dakota Falkowski, RN, BSN, and DNP student. Join us each week as I interview nurses from all areas of the nursing profession to uncover nursing opportunities that you may have not known even existed. You can expect to be inspired and maybe even a little bit motivated. The goal of the Nightingale podcast is to encourage you to think outside of the box, step outside of that comfort zone of yours, and reach for a fulfilling and unique nursing journey. So let's dive in and check out this week's guest. You never know, they may just have your dream job. Hi, Sharlene. Welcome to the podcast.
Hi.
We are so happy to have you here. You have such a really beneficial and just interesting nursing journey so far, so I can't wait for you to share it with our listeners.
I'd be glad to do that.
I would love to get started with just you telling us about your nursing journey, who you are, and just a little bit about yourself.
So I initially started thinking about going into nursing when I was in high school. I had a little girl that I babysat for that ended up having cancer and thought I was going to go into HEMOC related nursing and started my path down that way. Not even thinking initially nursing, but I thought maybe I'd go to PA school. So I actually started that. I went in to school at Central Michigan University and went in going to the fact that I would go to be a PA. Got done with my school there, applied for PA school, and got waitlisted my first year. In the meantime, I decided that I was going to continue doing some volunteer work at the University of Michigan in HEMOC. After being there for over 3 or 4 years, I decided that I thought that I did not want to be a PA anymore because I wasn't going to get the bedside time that I wanted, and decided to go back to school to be a nurse. And still thought I was going to be a HEMOC nurse until I went to nursing school and I decided I wanted to be a NICU nurse after doing my rotation. So I ventured down the road, found my hospital that I was at. I was working in the OB department as a scrub tech at that point. Talked to the NICU manager and asked her if they did new grads. At that time, they didn't. So I kind of pushed forward, thought maybe I could be the first new grad in this NICU. They took a chance on me. I think some of it had to do with the fact that I was in OB, so I kind of had a little bit perspective of a newborn baby and kind of what they looked healthy. So I was the first nursing new grad student to actually start in their NICU. And I have been in NICU since then and worked my way up a little bit to doing flight nursing.
That is awesome. I love how you started off wanting to do something totally different, and then you were able to kind of pivot a little bit and just kind of see, because it is so true that the PA role and the provider role especially is so different than the nursing role.
That is very true. I think some people go think they want to do one thing in medical and then they're given the opportunity to shadow or volunteer, and then you realize, I don't think that's what I want to provide as in the medical profession.
Yeah, and I think it is so important to listen to that. So it's so cool that you were able to acknowledge that.
It definitely threw me for a loop a little bit, and I spent a few extra years in school, but in the end, it was well worth it.
Yeah, and you know what? I think that is what is so funny is that we are usually very like type A personalities. A lot of us in the medical field are very similar in that we want to get things done. We really want to get to our dream goal of whatever position it is. So it is so true that sometimes you have to take a little detour, or you have to take that time. And really in the long run, it is such a short amount of time, and it so pays off when you are in the role that you really want to be in.
Very true. I think if I would have went into the other profession, I probably at some point would have veered back to nursing at some point, because of the fact that it wouldn't have been the goal I wanted and the bedside nursing that I wanted.
Right. Yeah. And then look at there's so many more doors too with nursing that you can take once you get into the field.
Very true.
So I want to talk a little bit about your OB tech experience and just how you got into that. What made you choose to pursue that?
So when I was in between waitlisted from Central, because my plan was to reapply, I was first on the wait list. They told me reapply next year, you'll get in. And I wanted to find something that would keep myself busy for that year. And so somebody told me, hey, you should go take the scrub tech class. So I did. I said, this will be kind of a bridge to it. I took it, and then I ended up moving from my little hometown of Hillman over to this little town called Traverse City, Michigan, and they needed scrub techs there. And I was able to get into the OR and kind of be able to help with C-sections. So I worked right in a OB ward, and I scrubbed for C-sections. My first one probably was one of those experiences that I said, oh, I'd never want to see this again. And then afterwards, I can tell you it was actually a beautiful process in some ways to kind of bring life into the world when it can't be done naturally. Mm-hmm. So I feel like that has been my building stone from day one, because I felt like I learned a lot from being in the maternity ward and building my skills up to the NICU population.
Yeah. And I actually, last week's episode was on tips kind of for setting yourself up for success. So I love that. I think that is such an important point, that if you're in kind of a waiting phase and you feel like you are waiting for that application, or you're building up your resume to apply for nursing school, then there's something that you can do to build your resume in the meantime. And what a perfect in for you. And all the experience that you gained during that time, I'm sure was so beneficial once you started as a nurse.
Yeah, and that was one thing that I wanted to continue to do when I was going to nursing school. So I actually stayed as a scrub tech in that hospital and went to nursing school at the same time. And the hospital worked great with me. And being in nursing school, I could relate a lot of things back and forth just from the experience I could get around being around other nurses.
Yeah, for sure. So tell us a little bit about your role in the NICU, like how long were you in the NICU before you made this transition? And just tell us kind of what the NICU nurse role looks like.
So when I first started out, I ended up having a graduate orientation since I came right out of nursing school and went right into NICU. It lasted around 4 months. There's some programs that last up to 6 months. So I was a building stone. I learned a lot. I started out with just feeder growers, so babies that were born maybe a little early but just needed to be working on feeding. And then I worked my way up to taking care of critical kids that needed ventilation or lines, a little bit more intensive care. The unit I started out in was a level 3 unit. So they take care of most babies, but they don't do something called ECMO, and they don't do cardiac surgery. So I didn't gain that experience there. So I worked there for about 2.5 years, and a physician came up to me and said, I think you need to start doing transport for our team. I was a little hesitant. I was pretty new to everything that was going on. And then I started my process of maybe thinking I needed a little bit more skill factor in that. So I decided I was going to go to our level 4 NICU that was in the area. It was in Grand Rapids, Michigan at Helen DeVos, which was about 2 hours away. And I basically did a regional travel position there to gain my level 4 experience. So I was kind of moonlighting there to gain a little bit more skill factor. And at the same time, I was learning the transport role back home. So that process takes a little bit of time because, as we all know, transports don't happen every single day. So I was able to take and get a little bit of experience every single time one came up. So that probably took a good 6 months before I was able to go out on my own.
I love that you were able to seek out that additional experience, because it does take a lot to acknowledge where you have just deficiencies in your learning or areas that you could improve. So I love that you kind of were able to start the position and at the same time acknowledge that I need to go to be the best I can for this position and for my patients. I need to go and get this additional experience. So that is so neat.
Yeah, you definitely, coming from a smaller NICU, you gain so much from being at a higher level NICU where you can learn a little bit more about cardiovascular. They offer certain classes like stable in my job for being a neonate stable and cardiac stable that are very beneficial to get you in the path of critical thinking. Could this be something cardiac or could this be something a little bit more? So it was definitely beneficial.
Yeah. Can you tell us a little bit about explain stable a little bit? Because that was something too that I didn't know until I was in that type of role. So if you could just explain a little bit what that kind of course is.
So stable is a course, Lynn Carlson actually created it, and she was a NMP that felt like when she went to other facilities that did not have a NICU, they needed a little bit of a guideline of what they could help nurses who are coming to pick up these babies by transport to stabilize them. So it goes through 5 processes of basically learning this is what you need to stabilize a patient before they can be transport. One of them, the S stands for sugar. We talk about temperature, we talk about airway, we talk about blood gases, we talk about labs, and then a complete evaluation of what the baby looks like so we can give the best information that we can to the receiving facility that's going to take this baby. So it helps stabilize the baby and helps actually create kind of a package deal for the team that's coming so they can pick the baby up and get it back to the referring hospital as soon as possible. It helps you, it teaches you a lot of skills, and it's one of the best classes, I think, for a new nurse or even a seasoned NICU nurse to take.
Yeah, I totally agree. Because when I actually had started transport, I remember you talking really in depth about stable, and I just got the book and dove into it. And it really is like so amazing. And it really goes through every single phase for you. And it really makes you feel more confident.
That is very true. I feel like, and a lot of people use that book as a reference book because sometimes, there's lots of facilities that don't have NICUs and they don't use it every single day. And that book is a great reference book. There's lots of times where I pull it out sometimes just to make sure, oh yeah, that's right. Labs are important in our population. And I can tell you, I use that book quite a bit for labs and everything to make sure that my patient isn't in the area of where they have an infection rate, because we look at ANCs and IT ratios, and that book gives great references on that.
And I think this population is so different than the adult population or the pediatric population in that way. So it really is a great resource for someone who maybe is looking to get into NICU or is on transport and you aren't familiar really with the NICU population as much. I really think that this book is, and this course is so unique to that.
Very true. And the cardiac portion of stable too is a very good basic knowledge, and it's easy. We stated in the cardiac stable book and the class itself I feel like it gives a lot of people who don't know a lot about neonatal cardiac defects and stuff a very good outline of what we need to do to take care of these patients. And lots of providers that teach that class do a great job doing it.
Awesome. So if you could tell us just a little bit about, like, what does the transport role look like, especially for your population? What population, I guess, if you could tell what age groups you're seeing and just what the day-to-day role of a transport nurse entails.
So transport, if you do neo-peds transport like I do, it can be any baby that's 22 weeks, which could be 500 grams or less, up to 18 years of age. Once in a great while, we take a few patients of greater than 18 years of age, and it's just because it's been a chronic patient that's known to the pediatric facility. So they will definitely still go to a pediatric ward over the age of 18. For instance, cystic fibrosis patients, a lot of them are seen in the pediatric hospital for a long time. For flight nursing in the pediatric world, you definitely have to have your BLS, your ACLS, your PALS. Most of us, before we get into transport, we're certified, whether we're certified in NICU or certified in pediatrics. Or certified, some people take and go into the emergency department, find a role. And then on top of it, some populations, you'll end up having to get your TNCC, your trauma nursing certification. And there's also one out there for pediatrics, which is ENPC, Emergency Nursing for Pediatric Nursing. You definitely need those at some point when you start flight nursing, whether you get it after you started or before. If you get it beforehand, your chances of getting a position are a little bit more. The regulations in every state vary. Sometimes you need your EMT, and other places you need your TNS, which is your trauma nurse specialist. So that kind of varies from state to state. The things that you kind of provide as a transport nurse varies from like state to state also. Some hospitals, basically, the flight team hangs out at the hangar. Other hospitals, it could be a NICU-driven transport team where your NICU nurses are part of your daily care and your NICU patients, and they come directly from inside your unit. So there's quite a different variation in programs out there, but most programs you're going to do, you're going to provide air response to emergencies, whether you're working in the pediatric population where it could be a C emergency, or you could be working in the NICU population where it's a hospital-to-hospital transport. These transports can take place by being airlifted by rotor, by helicopter, or fixed wing, depending on how long it takes you to get to location. And it also can be done by ambulance. There's a lot of facilities out there that have baby buses that are built mainly just for NICU patients, and it has what you need in there to take care of a neonate. So basically our day starts out, usually we round with our pilots and we round with our team to see what our day's going to look like. Sometimes we have take-backs, which are basically taking a baby from one facility to another, or it could start out knowing that we have a transport already, and we check all our equipment, do our stuff that we need to, and then we go out on transport. And when we are out on these transports, we are run by protocols at hospitals, so we have a standing protocol that kind of allows us to take care of the patient to an initial step before calling back to our medical control officer, whether that be our NICU doctor or our PICU doctor or our emergency room doctor. And while we're out there, we manage vitals like we do inside. We do intubations, we can do chest tubes, we assess any type of assessments. We're allowed to give certain drugs without calling back. And some of these teams are made up differently. Some of them are RN to RN teams, and some are RN RT teams, and some of them are RN EMT teams. So every flight program has a little bit different variation. So they're made up a little bit different depending on what the facility wants. And then sometimes we go and pick up from another facility patients who have been there for a while at a higher level NICU and bring them back to a higher level NICU just to have surgery so they can get the needs that they need at that point. Some places, if it's a in-hospital team, you're also expected to go to codes during the daytime. You're expected to start IVs because you become the IV specialist kind of in the hospitals. You're used as a resource, nurses a lot. Sometimes you attend other deliveries if you're available. You're able to act as that kind of resource for the hospital.
I think this is really a role too that if you are someone that is seeking more higher level of skills, if you're someone who's seeking higher adrenaline, if you're someone who is seeking, maybe you don't want to go back to school, but you really are looking to expand your role and act more independently, then this is definitely a role for you. Don't you agree?
I definitely agree. And everybody is always asked, well, what made you go into flight nursing? And I said, I was pushed into it. And I said, I didn't really even think this was on my path until somebody said, you need to try this. You really like higher level acuity. And I'm glad somebody did because this is absolutely me. I am very type A. I love to get out there and kind of do my own thing, but still have that medical control to kind of guide me if I need it.
Yeah. And you do get so good at your job. And I think it is just so amazing. Even all the hospitals that I've worked at, just seeing the respect and the utilization of the flight team from those within the hospital as a resource.
Very true. Very well respected. And I feel like every place that I have been, I feel like it's a different venture. It's kind of different from hospital to hospital, how you're used. And I kind of like that aspect of it.
Yeah, for sure. The variety is so awesome. Friends, starting a new position is scary. It's frightening, it's overwhelming, it's exciting, it's all of the things. I know, I've started many new positions in my time as an RN. But really, it doesn't have to be as difficult as we try to make it. Through these experiences, I have gathered 5 tips to starting a new position and making that transition as smooth as possible. I have created a free guide for you as my listeners to make this transition as seamless as possible and allow you to really excel in your new position. So if you recently started a new position, you are going to start a new job, or you know someone who's going to start a new position. I mean, come on, you have to fall into one of those 3 categories. Then head on over to thenightingalepodcast.com to sign up to receive your 100% free copy of the 5 tips PDF. I'm here to support you through all your new ventures in your careers, and I believe these 5 tips are going to do just that. So head on over to thenightingalepodcast.com after this episode and download your free guide. I mean, come on, what do you have to lose? So speaking of variety, you have a lot of variety because of your traveling. So can you talk about your role as a travel nurse and just the different things that you do with that and how that kind of plays out?
So I started traveling about 4.5 years ago, and my top goal was to go to the top 10 NICUs in the nation. Had nothing to think that I could be able to do transport out as a traveler. So I started out, went to some big hospitals. I went to Lucille Packard, which is Stanford's campus, Colorado Children's, DeVos. And so I decided, well, this is a great adventure. And one of my recruiters called me and said, hey, this hospital wants to talk to you about doing flight nursing as a traveler. And I said, yeah, I'm not interested. That's not for me. I didn't want to venture out in there because it kind of puts you at one of these spots where you're close to your doctors back home. They know you. You have a good rapport with them. And then going to a different place and getting the same rapport, I didn't know if I could get that. But after talking to this facility for a long time, I decided that maybe this was a venture I should take. I went to the University of Iowa and did my first flight job as a traveler. I had done traveling back at one of the level 4s back home, but that was different because I felt like I knew them very well still. And I took it on as like, I'm going to make this work. And I stayed there 6 months with my contract, and I ended up extending for a year. The program was great. I learned a little bit about being in a different area and the different rules of their flight program, because I've always come in from a base unit flight program, where theirs was not based in their NICU. It was based outside of their NICU. So the role was a little different. And so then I continued to do some more traveling after that, hit some more big NICUs like Boston Children's, Brigham and Women's, and I got another call to take and do another flight job in Orlando. And that was a whole different world for me. I didn't put in the aspect of traffic when it came to Orlando as much. And so when I went there as a flight nurse, I knew that their flight program was just starting and it was getting off the ground and they were working on it. So I didn't put in the water factor, and I learned that down there flight is completely different than it is in the Midwest area. So I went through some training of water safety down there as a flight nurse, because we don't offer that where we're at in the Midwest, because we don't fly over bodies of water very often. Most of the time we would take those by fixed wings, so it's a different type of rotor. So I got some experience there, and I got lots of experience in cardiovascular. And I think that's with traveling, every place you go, you learn something different. You gain some new adventure. Just because you learned it one way doesn't mean it's always going to be that way. And I feel like if I hadn't been able to travel, I definitely wouldn't have gained the skill set that I have gained today. I feel like that has actually brought me a little bit to be a better nurse. And it makes me have a little bit more critical thinking skills, because each hospital that you go to offers up something just a little bit bigger into the picture where you never thought about it of that aspect. When I was in Colorado, for instance, I never really thought about elevation as a factor in treating babies that are on respiratory support, and got a really big eyesight for my first kid that had RSV that I didn't think needed to be intubated, but ended up being intubated because of elevation as a factor.
I think, too, that it is just so amazing to see in any traveler, just the confidence that you have and that you have to have. I just loved that you are totally reliant on your skills and your knowledge, rather than sometimes when we're in the position, we are kind of reliant, and we grow our confidence just on the fact that we know the providers, we know the hospital, we know where everything's at. So I love that really teaches you just the skill of being confident in your own knowledge and being a resource for other people.
Yeah, and I think my home hospital benefits from it from the most, because I feel like every single place I go to, you gain a little bit more knowledge and you can bring it back to them. This, as a traveler, I feel like you do more research just because one place is doing it different than you have learned. So you try to figure out what your best practice is going to be in your own practice, because of the fact you're learning it so many different ways.
Oh, I totally agree. I think that's so true too, even with just people who try different positions. I've had several different positions at many different hospitals now, and it is so beneficial, because even if you're not in that same role, you're bringing a lot to the table because you do have that. And sometimes you'll look at things that they're doing and just start to question, like, oh, why, like you said, start to research what is the best practice? Why aren't we doing this? And a lot of times they just don't know. It's not like all these hospitals get together and discuss, oh, how do you do this process? No, that's not how it works. And there's so many different ways to do things. So bringing that knowledge back, and I think that is so cool about your role and you as a person, that you have gone in as a traveler. Obviously, they're short. They are in need of you, and for whatever reason, and you're able to, I feel like, in a lot of ways, help their organization.
Yeah, I think you're able to help, but then you gain so much from it too. I feel like some people always say, well, you help us learn different ways. And I was like, no, you help me to learn different ways too. And I think like if you're going to be a traveler, you have to be flexible because you have to go in and be like, okay, they do it this way. There's a reason why they do it this way. And you kind of have to go with the punches because I think that can be a huge roadblock as a traveler is being flexible because you might have done it one way. Unless it's going to cause harm to a patient, then you need to do it the way the facility wants to do it. And I think sometimes that's your biggest roadblock as a traveler is learning other things and knowing it's okay to do things different.
Mm-hmm. Yes, that's so good. I think too that it's just it's good for you to see how some people do things, and even if it's not how you want to do it, this is for students, this is for nurses, providers, whatever, that sometimes when you see things that aren't done right, it's beneficial for you too, because you're learning how you don't want to do things too, and you can take that on in your future practice.
Very true.
So if you could tell us a few of the positives about your job, what benefits do you really love about your job, and a few of the negatives, some things that someone might want to consider before diving into this career path?
So positives for sure in the pediatric role. I think sometimes when we have babies that are born at 22 weeks, 23 weeks, and a year later their parents bring them back into the NICU to show their progress that they've done, or they write a letter to the flight team saying, hey, if you weren't there, this would have been a different outcome. I feel like those are what keeps me doing what I do every single day. The positive outcomes, they happen. They definitely are good ones. It's a great feeling. The other thing is if you like change, I feel like change is one of the things in the nursing profession that you have to be with. I love change. I love seeing things go from, we used to do it this way, but now we're doing it this way. I feel like we're progressing towards a goal to take the best care that we can for the next generation. One of the negative aspects of pediatrics and neonates is the fact that no one wants to see anybody die, especially a baby. It's probably one of those things that's supposed to be the most glorious time in your life that you see this birth happen. And unfortunately, it's probably the worst time in your life. My first neonatal death I had some very great coworkers because they said 60% of NICU nurses who go in this profession will quit this job because they can't deal with the afterlife process of it. Very true. I can tell you that rocked me for a good month or two. But I also learned that if I didn't do this, who would? I know lots of people ask me, well, why didn't you want to take care of the adult population? I can't do adults, I'll be honest. And there'll be a lot of NICU nurses that will say to moms who feel a little lightheaded when they come into the NICU, like, I don't feel good. And most of us will say, maybe you should go back to the OB world because we don't really do adults. So I feel like if you have a hard time taking care of kids and some don't always work out the way you had planned, you have to know that you've done your best and you have to move forward. And sometimes that's the hard aspect of this position.
I think I totally agree with you. I think that just having that mindset that you were there to support them in whatever the outcome was, that you did your best, and that you were there for the parents, you were there for that child, and you were really beneficial to that person in some way, even if it was not a good outcome.
Very true. And there's lots of parents that I've talked to that I've flown other places that it wasn't a good outcome. And I still talk to those parents at least once or twice a year. And I think some of that gives me closure too. And I think it gives them closure from time to time. And sometimes that's all we need to do to kind of give ourselves a clear head that, they're still thankful and I'm still thankful that I could at least have this bond with them, even though it wasn't a good outcome in the end.
Yeah. And I totally agree. I think that even with any age, I think that family likes to hear that we are impacted by their death or whatever outcome. They like to see that we're human, and they have this connection with us that they don't have with their family. And it's unique because we were a caregiver for their child or for their family member. So I think it's so good that you say that you be honest, be real, and don't be afraid to share with them or just to connect with them.
Very true. I think sometimes that we try to be the strong person, and we always don't have to be the strong person in this population.
Yes, for sure. So for people who are, I guess let's start with NICU. So for people who are trying to get into NICU, or this is an area they have a lot of interest in, what would you say kind of their first steps should be to start to transition into that role?
So some hospitals don't have graduate nursing that you can go right into the population. If your facility does, the first thing you need to do is talk to a manager, show that you're interested, because you showing that you're interested, they definitely will look at you in a different way instead of you just applying. If you show interest before you even apply, that's your best opportunity. Secondly, not every place does, so some places make sure they want you to have at least 1 year of acute care in the adult population before going there. Not a bad idea. I never went that way, but a lot of hospitals, that's a requirement to take and get into the NICU, to start taking care of pediatric and NICU babies.
Yeah. And I think, too, if you do have to take that route, I think it's so important for you just to soak everything in and just realize while they're very different populations, you're learning to deal with vents in a much larger airway. You're learning to do blood draws. You're learning to manage art lines and do drips and things like that. And so that is so beneficial.
Yeah, it's a completely different population. Like you said, it's day versus night, and sometimes I think people don't see that in a real big aspect, but it is. Like drip factors and all that are cut completely sometimes into a fourth of what they are actually supposed to be given to a patient.
Mm-hmm. And then so on the flip side of that, someone who maybe already is in NICU or they're already in a peds ICU or even just adult, I guess, what steps do you recommend taking to make that jump and start to prepare for a transport role?
So for the transport role, you definitely need to have 2 or 3 years of critical care experience. Any flight program will definitely tell you that they want you to have that critical care experience before you're even able to apply. Most people, they start to go out and, you have to have BLS on that and your ACLS and your PALS and your NRP. But if you've given the opportunity beforehand, I would get certified, whatever department that you're currently in. If you get certified, you're going to have a better chance. And the other thing is taking TNCC, your trauma course, or your EMPC, your emergency nursing pediatric course. Taking those before you even apply for the job will give you a better chance of getting the position.
Yeah.
Most of the stuff of training for flight, you're going to get in your flight program.
Yeah. I love that you say that, and I love that you suggest all that experience, because when I did my short time in flight, I did not have a ton of experience, and it is very scary, I'll tell you, to go into a position like that. You learn so much on the job, but you are stepping into, like we talked about earlier, such an independent and such a high risk kind of position where you are on your own. You're going out and you're viewed as an expert. So definitely, I really recommend getting that experience before you dive in, and you will just feel so much more confident going forward.
That is very true.
So did you, over your time as a nurse or at all in your life, I guess, did you learn any big lessons or receive any big advice to kind of get you to where you are today?
I think one of the biggest things, the lessons that you can learn, is always take a chance to review, especially in flight. You took this flight, you did everything you could, look back on it, see where you can learn from it, ask people for advice. I feel like our physicians are experts, and sometimes bringing a patient in I always sometimes, if I didn't feel comfortable about what took place, I always want to go back to that physician and be like, what could I have done better? What could I have changed? Those are the skills that you can gain. If you can ask for advice, it's okay. That's part of our job. Always ask others. And working as a team, too, I think is one of the biggest things. You will learn so much from other people, too. And I feel like if you can take and do that, you will definitely be a great nurse and feel more confident in your skill factor.
Yes, that is so good. I think, too, that this is such a high-paced environment, so that is so important, like you said, just to reflect back, because a lot of times it's not like it's somewhere where you can kind of think through it as you're going through it. Like, no, you just kind of have to do it, and then afterwards learn from it for the next time. So I love that advice.
I feel like if you can reflect, I think you learn more from reflecting on something if you just didn't have the outcome that you expected.
Mm-hmm. So true. So if you could tell us, a lot of the podcast is about just being motivated, reaching for big goals and things like that. Do you have any long-term goals that you are kind of working for?
I always thought I was going to do pediatrics and neonates. I have now ventured a little bit on learning a little bit of the adult population, because I feel like some flight programs you're able to do all three, and I might venture out in that direction. I've been taking a few courses here and there to maybe stretch that limit a little bit, just because I want to be more well-rounded.
I love that. Well, Sharlene, thank you so much for joining us on the podcast today. Your journey is so unique and it is so beneficial for people to hear. So I really appreciate you sharing it with us.
Thanks for having me.
Thanks for listening to this week's episode of the Nightingale Podcast. If you enjoyed this week's episode, make sure you subscribe so that you are getting weekly notifications when the new episode comes out. And while you are there, I would really appreciate you leaving a review, and maybe your review will be featured on an upcoming podcast. You can check out all episodes at thenightingalePodcast.com or on Facebook at The Nightingale Podcast.